Kristen, modern medicine is doing amazing things these days, and an area that we'd like to focus on today is radiology, Pinehurst Radiology. They can do so much and find out. When it comes to diagnosing problems, it seems to be, a big part of getting to the cure, and we can do a great deal of that with radiology, and I'm so happy that we have radiologists in the studio with us.
That's right. We have done our TV piece now for Pinehurst Living, and Pinehurst Radiology is going to be on that. So you'll be able to see what the facility looks like if you're new to the area or you would just like to, check it out. It's very, very informative. But we're lucky to have Dr. David Furie in with us this morning just to give us a little bit of background, David, on how long Pinehurst Radiology has been there. I was shocked to find out how long it had actually been in the area. Really, really amazing.
Pinehurst Radiology Group has been in the area for about 30 years. We are 11 radiologists at 3 practice locations, First Healthmore Regional Hospital here in Pinehurst, Montgomery Memorial Hospital at Troy, and of course the Pinehurst Radiology Clinic on Page Road and Memorial Drive.
How long have you've been in this area? Quite a long time too, right?
That's about 10 years ago. My wife and I were looking for a place to raise our family. And we were introduced to the Southern Pines and Pinehurst area and immediately fell in love with the sense of the small town feel, the superior medical care, and the fine schools. And in particular, we were interested in living a healthy and active lifestyle. And there's so many opportunities here in Pinehurst and Southern Pines to do that. And it's only been this past year that we started playing inline hockey, actually.
Oh, fun.
Hey,
yeah,
I've seen that before.
Park. It's a lot of fun. And
yeah.
I mean, who would have guessed that a guy from New York and a gal from St. Louis would have to come to a small town in North Carolina to learn how to play hockey, but it's true. So we've been very pleased with our move here.
Good. Well, we've heard the term radiology, radiologist. Tell us, what exactly is it?
Well, first, let me just say that's a good question. I was engaged to my wife, and we had an engagement party, and her papa or grandfather came up to me and he said, "David, why don't you go on with your education and actually become a doctor?"
You're like, oh my gosh.
That's a popular misconception. We are physicians.
Yeah.
And we go to medical school and we complete our internships, residencies, and fellowships. These are different layers of education. And what a radiologist is essentially is an expert in interpreting pictures of the body to diagnose disease and to assess treatment. Now, we use all kinds of machines. We use ultrasound, MRI, CT, nuclear medicine, and digital mammography. An example of what might happen is a patient presents, or someone that you might know or love, has a sudden onset loss of use of an arm, or they have slurred speech, and that might be a stroke, and that's an emergency. You need to get that person to the emergency room as soon as possible. That person comes through the door, and they're immediately sent to the CAT scan unit, where an expert in interpreting those CAT scan images of the brain, the radiologist, will look at those images and to determine whether you can get the life-saving, clot-busting drug that can really make a difference. Some of our radiologists, including myself, there are 2 others, are interventional radiologists, and we perform minimally invasive procedures. And I'll give you an example of something. A patient may present to his doctor with back pain and get a plain film, which is just a regular x-ray of the lumbar spine, and they look at it and they don't really see much, and the patient has pain for an additional week, and they end up getting an MRI. In an MRI, we might see something, a fracture, and we can actually tell whether it's new or old. And if it's new, that's something that can be treated by a minimally invasive procedure we call vertebroplasty. And what we do is we have the patient lie on their stomach, and we numb up their skin, and we put a small needle into the spine, and then we can place some glue or cement into the spine and solidify that fracture. And basically, months of back pain or weeks of back pain are then relieved in minutes.
That's amazing.
It is quite amazing to see the response.
And people with back pain know, I mean, I've never had it myself, but you talk to people with that excruciating type of pain. Rich, your mom went through it.
Going through it.
And going through it still. It is something that you are looking for relief. An instant relief would be so awesome.
Yeah. And let me ask you a question, Dr. Furie. When you're doing an MRI, it seems like I've never, without exception, people seem to be lying down. Isn't it ever necessary to have a load-bearing MRI to see? I mean, I understand when you're lying down, everything's kind of relaxed, but when you're actually bearing the load of gravity and your weight, things might look a little different.
Yeah, that's true. I mean, most typically MRIs are performed with the patient either on their back or on their stomach. There are occasions and there are places where MRIs are done with the patient in a seated position, with them exerting effort against the resistance.
Oh, okay.
That's not a very typical situation, however.
Okay.
There's quite a bit of new at Pinehurst Radiology. Again, we covered that in the TV piece. But you've got some new personnel, some equipment. Tell us about that, too.
There's a lot new at Pinehurst Radiology. It involves personnel, equipment, and convenience. We've hired 2 new radiologists. One of them is named Michael Edwards. He's a neuroradiologist who's trained at Duke, and that's where I finished my training. Lacey Moore is a musculoskeletal radiologist that will be joining us in July of 2008. Musculoskeletal radiologist emphasizes areas of the bones and muscles. That'll be very beneficial to our local orthopedic surgeons and patients.
Okay, and does it make a difference where you go? We address this, and this is an important question, because if you're at your doctor and you say, you have gone to Pinehurst Radiology, and they may do that at their own facility, or they may refer you to another one, you can say that you want to go to Pinehurst Radiology. So keep that in mind. But does it make a difference where you go and have the imaging and the study performed?
Kristen, it really does, and you need to make certain that your radiology or radiologist has the most beneficial situation so that you can benefit from the exam. And that means the quality of the radiologist, the experience of the technologist, and the equipment used. Our radiologists are all board certified with subspecialty training. Our technologists are very experienced, which can make a big difference when you're having something like a mammogram where positioning and patient comfort is so important. We have the latest technology. We have digital mammography. We have something that's very rare in the area. We have a PET scanner, which allows us really to evaluate patients who are already diagnosed with cancer and to see if that cancer has spread somewhere else and to evaluate the treatment. That's something you don't see in a town this size.
How is that specifically different than like an MRI?
Well, an MRI uses magnetism and radio waves to generate a picture. In the PET scan, we use a sugar molecule that's tagged with a radionuclide. And so the sugar molecule actually migrates to an area where there's a lot of overturn of cell and activity, which is often a malignancy and not normal tissue. And that's one of the things that defines a malignancy. It's tissue that regenerates at a rate that's much more rapid than is normal.
So as a PET scan, is this cutting-edge technology?
Oh,
this is
absolutely leading and cutting.
And this helps in the diagnosis of what's going on with someone who's been diagnosed with cancer.
Over the last, I'd say, 2 or 3 years, it's become so important in treating patients who have known cancer and evaluating as to whether they have metastatic disease to other parts of their body.
Okay.
And to assess treatment, particularly in breast cancer and colon cancer. So I think a lot of your listeners will probably be getting this test at some point.
That's when a new scan, when a new treatment, when a new method of diagnosing comes out, it's important to get that information out. PET scan, PET.
Correct. We're really into the animals. We have CAT scans and PET scans. I don't know what's next.
That's right.
Well, it's easy to remember. That's the good news. And you do have cutting edge technology. I was amazed to see the way things are read now. It's astounding to see. You should, Rich, take time to go over there someday and see the technology that they do have available to you there.
And it's also painless too.
All these tests, I would say, are painless. That's correct.
Yeah, it's amazing. It's great. You don't have to go in with any fear or apprehension.
No.
You go in, they do it, and they do their thing. And it's modern medicine is amazing.
Easy to get in and out of Pinehurst Radiology.
Oh, yes.
You just pull in, you head in the front door. The people are so nice there. I've had a mammogram there. I'll say that. And in and out in 15 minutes maybe. I was in and out so quickly. I was amazed, and it did not hurt. I'm going to say my mammogram. Now I know some people do associate pain with mammograms, but I thought, wow, these people really know how to do this. How can you have an exam performed at Pinehurst Radiology? What do you do?
Well, basically, if you have an exam at the hospital, all those examinations are interpreted and performed by Pinehurst radiologists. If your doctor has given you a prescription for an exam, you have the opportunity to have that exam where you'd like to have it, as you would if you were given a prescription for medicine. And you just need to let him know that you'd like to have it at Pinehurst Radiology.
Okay. Well, that's great. Phone number and location.
We're located on 30 Memorial Drive at the corner of Page Road and Memorial Drive, and the number is 910-295-4400.
295-4400. It's just as easy as that, Rich. Go see your doctor, get a referral, and you can ask to go to Pinehurst Radiology. If you've been comfortable there, you can be guaranteed it's easy in and out and accessible.
It is. Dr. David Furie, thank you for coming in.
Thank you for having me.
Thank you.
And now, Dr. Furie, before we let you go, I understand you have extended hours?
That's right, Rich. For the convenience of our patients, we're offering expanded hours Monday to Thursday from 5 p.m. to 7 p.m.
Monday through Thursday, 5 p.m. till 7 p.m. That way, if the hustle and the bustle and the working, I mean, it's tough to get in at those regular business hours, so this adds a little flexibility, a little latitude for other folks.
That's right.
And the number?
910-295-4400.
Okay, give them a call. Thank you, Dr. Furie.